Thank you very much, Dr. Milind. I have had the privilege of moving around in different countries with him, and I know in what kind of forums and in radiology circles he gives talks. So it's a total blessing that he could give a talk today. And in fact, he is going back to the US tomorrow night. And he had such a cramped schedule, but still he agreed to do that. So thank you very much. So let's understand more about this system, Free.Max, in the next few minutes. Before that, I want to say that I totally love MRI, and that is the reason I'm standing here in front of you. And I love the fact that this hall is completely full. Thank you so much once again. So through the last 2 decades, I discovered that radiologists love high resolution. No, absolutely. And clinicians also love high resolution so that they can see the different abnormalities and talk to the patients. So does that mean clinicians love radiologists? Well, that can get a little twisted. So let us say clinicians like radiologists. That would be a little more safer. And as we go ahead, I might just want to represent a few things that may make you like me. That is, I am completely a local lad, a student of Singhania School. And then I went to medical college at, say, GS Medical College and KEM Hospital. And I'm still very much in touch with all my friends from there. After that, I did my specialized training in MRI and CT at Hinduja Hospital in Mahim. And when I was at Hinduja, I had a very, very strong feeling that I should get to do MRI fellowships. And I became lucky after a few years, where I did fellowship in joint MRI in the capital city of Switzerland, in Bern. And in fact, the same year, end of the year, I was very privileged to be at NYU in New York. And after that, coming back, thought that we should have some very good system in our center in SunScan. So we went for Avanto, which was that time a complete blockbuster in the 1.5 segment in the MRI. So we had a 18 channel, which was the best MRI that time in our city among the 1.5 segment. And I got very lucky when I had a chance to give a talk in my parent institute at KEM 2 years back. And furthermore, the same year, I was featured in the most popular textbook of radiology, David Sutton, in which a Neuro case was accepted, and I featured in that textbook. But we are just talking about you and me, whereas the most important person in the MRI is the patient. And I remember in JMOT in KEM, there was a board that was written, the most important person in the operation theater is the patient. And then I extrapolated the same here. But then, of course, we do face some problems where the patients are not very comfortable, or sometimes they get really, have problems being in the MRI, and even severe problems at times. And that is the time where I thought that there should be something that can solve this problem, something that is good for the patient and for the clinicians, and then God bless me.
It seems like the world is programmed, that all we know and everything we are is held together by the laws of physics, by the conventions of society, and by a predetermined concept of reality. We are conditioned to believe that we must conform, but what we forget is that progress does not emerge from following existing paths. True progress emerges from the audacity to explore beyond existing barriers. If limits exist, they can be overcome. It is time to expand our thinking and go further. And expand reality. we must break down the barriers in our mind, driven by the urge to change things for the better, the urge to improve patient care. A new reality of MRI has been created to explore new clinical paradigms and expand the reach of MRI. MAGNETOM Free.Max, breaking barriers.
Breaking barriers of fear, breaking barriers where the patient says, I don't want, I can't, to I can. And so here we have a patient who would be doing his scan in a Free.Max and very happy about it. So introducing to you, ladies and gentlemen, the first 80 centimeter open MRI bore, that is the Free.Max, which has, the patient has no anxiety and no claustrophobia. And as we all know, there are always coils which help us to generate the images. And the coils with the Free.Max are absolutely beautiful. They're just like pillows and very, very comfortable for the patient and very lightweight. So you have these are called contour coils. So you have a contour S coil, which is a small coil. You have a contour M coil, which is a medium coil for larger joints. And you have a contour L coil, which is the largest coil for the abdomen. Now, as Dr. Milind has talked about AI, and the synonymous to AI is deep resolve. So in deep resolve, what happens is there is a significant denoising and the image becomes clear. You can see that the conventional reconstruction, the clarity compared to that, the clarity with deep resolve is so much better. Now these are all the routine sequences that we do for a neuro exam, including the angio. And deep resolve, the Free.Max is very good for even small anatomical areas like the pituitary. And I was very pleasantly surprised when I could see that capability of Free.Max for these areas. So even areas of internal auditory canal where you need very, very thin images, as well as angiograms of the circle of Willis, intracranial angios come out very well. Now, we will gradually, quickly go from the head to toe just to demonstrate that all anatomical areas can be scanned very well with the Free.Max. Now, the cervical spine, the sagittal and axial images. Now, actually, in the cervical spine, in many scanners, we face a difficulty, which is because of susceptibility. That is, where the different tissues are very much in close proximity to each other. So in the cervical spine, you have the vertebral bodies and the air, which are very much in proximity to each other. And we use a sequence called gradient, which is very susceptible to these artifacts. Whereas with Free.Max, we do not get these artifacts. Larger areas like the dorsal spine, the beautiful images of this lumbar spine, and also images of the lumbar spine with metal in place where there is very, very less distortion. Whereas in other systems, there is a very high distortion that takes place. So we have one more algorithm, which is called as the simultaneous multi-slice, or the SMS, which further reduces distortion and which is also complementary to the deep resolve. Also, whole spine imaging is seamless and can be done much faster. Joint imaging is very exciting, and I have so many orthopedic friends here who will agree that more detail is required, and this system can completely deliver that. Now, for example, in my system, the shoulder MRIs used to be very, very difficult for the patient because their pain used to increase because of lesser space and patient being in the same position for a while. Now with the Free.Max, with a larger space, the patient will be comfortable much more, so less movement and great images. Also smaller joints like the elbow, where sometimes you need to see the collateral ligaments. or much smaller joints of the wrist, where you need to see one of the most smallest yet most complicated structure like the TFCC complex tear. This can all be done very beautifully. And of course, MRI of the hand, or when somebody has to do MRI of the thumb, right from positioning the patient and patient comfort and then further scanning is a challenge. But with more space available and with deep resolve, it's going to be much, much easier for the patient as well. And for routine imaging, everything can be discerned right from the marrow abnormalities to cartilage to intrinsic structures like the menisci. And more so, the heavyweight patients can be now scanned much, much easily. Patients with more than 200 kg weight can be scanned, and we can give such images even in extremely obese patients. MRI of the ankle, where we look for so many ligaments, and over the period of time has become one of my favorite area, because when you have high resolution, you can see more, you can diagnose better, and help the patient to heal better. Even smaller FOV areas like the foot, where you need to focus on very small anatomical areas, will be possible much better. And presence of metal implant will no longer be a hindrance because of the hardware of this machine. Even without using any advanced technique, the distortion is going to be much, much less, as is seen in the shoulder here. And if you see this, the upper row, it has been, the images are acquired with warp, which is a metal artifact reduction technique. If you see the bottom row first image, you can see on the right side there is a lot of distortion, and that is what happens when metal comes into a magnetic field. But now with warp, this is going to be, we are going to get much better images. And in this case, where the quantity of metal itself is so high, still there will be no problem, and we can do the scans much better. Or patients with knee replacement, and also where there is metallic prosthesis in the spine. Well, in such a case, in a usual MRI, the distortion is so high that sometimes we can't even see the cord properly. But when we use warp, as you can see in the first sagittal image, the vertebrae as well as the cord are seen very, very clearly. Even cases where you have somebody has undergone a ACL reconstruction, and in this case where there is a fracture in the lateral femoral condyle, all can be seen very well. Abdominal imaging is going to go to a next level. Firstly, because the patient is going to be very comfortable. Now, most of our sequences are breath hold sequences, so patient has to hold the breath. Now, because he is in a much larger area, that's going to be easy. Also, some sequences are free breathing, where the patient breathes freely and we are doing the MRI. So in these cases also, the patient can breathe more uniformly and the MRI can be done well. And in abdomen as well, diffusion is very nicely done with the Free.Max. So this is an example of diffusion. The first image which says B50, the second is B800. These are the B values for the diffusion, and the last image is ADC. Now you can see that there is a small subcapsular area here which is bright on ADC. As long as a lesion is bright on ADC, it's most likely a benign lesion. Now this is another case where there is a very, very fine area in the liver which can be just appreciated. And this is thanks to the image quality, high resolution, that even such subtle lesions can be picked up. Now we can see that in diffusion, this lesion is bright, and on ADC, it is dark, and that is the hallmark of a significant problem. And in such a case where we have a focal lesion, we'll always give contrast and try to characterize the lesion. So on contrast, you can see that the lesion is enhancing significantly, and this is more likely to be a malignant lesion. Another case where there is a pelvic mass, you can see on the left side, that is fairly bright on the first image, which is the T2, but has some dark components. That is, it is cellular to some extent. And if you see the last two images here, it is enhancing very heterogeneously. And in fact, in the angiogram, there is slight indentation here on the left common iliac artery, and this is very likely to be a malignant lesion. So over the last few minutes, I hope you agree that we have covered all kinds of cases from head to toe, and my aim was only to portray to you that this is a complete MRI system which can do scan for all anatomical areas. So just to wrap up, what's the take-home message? It's an open MRI? Yes, definitely. It's a wide-bore open MRI with a diameter of 80 centimeters. That's the highest available anywhere. So definitely it's a boon for claustrophobic patients, because unless they get the MRI done, they can't be treated. Presence of AI gives us very, very high resolution, and it also makes acquisition very fast. The software of the Free.Max is the same as that of a 3 Tesla, and that also adds to the resolution, and it is so good at even in cases like abdomen or very small joints. And to sum it up, this is a complete MRI for all patients, not only claustrophobic patients, but all patients from head to toe. So I started with saying I love MRI, and now I can say I love Free.Max. And thank you very much for your patient hearing. And I end with this audiovisual.